Welcome to this video in the Ritter Cares series. My name is Julie and I work in reference at Ritter Public Library. And I'm here with Rhonda today from Kingston of Vermilion to talk about different therapies that might be beneficial for older adults. So physical therapy, occupational, and speech therapies. So we'll just go ahead and jump right in. Rhonda, would you like to give us a kind of an overview of the services your department provides and how people are referred to you and your staff?
Absolutely. We offer, beyond nursing, for an outpatient, we offer physical, occupational, and speech therapy. Prior to COVID, and I'm assuming down the road, we'll also be offering some wellness community classes, exercise classes as well. But right now, during the pandemic, we're continuing to offer outpatient, PT, OT, and speech.
So I thought we would just go through a couple of the therapies and ask a couple of quick questions about them. To start, for physical therapy, I think people are a little more familiar with that one. But starting any therapy could be daunting. And I think one of the questions people might have is, should I expect physical therapy to be painful? Do you have any advice on that?
Sure. No, physical therapy should not be painful. And you shouldn't be nervous to come to your therapy sessions that it would cause pain. If anything, physical therapy and occupational as well try to focus on pain relief management. We want to stretch and we want you to get the maximum movement as possible, but without pain. Some things that we do recommend is talking with your physician and maybe taking Tylenol or prescribed pain medication prior to your session so that it helps with that movement, helps with you being able to stretch through without pain. And then we also utilize during our sessions things like moist hot packs, cold packs, maybe a TENS unit, which is like a little bit of electrical stimulation to help alleviate pain while you're doing the movement. And then we recommend a lot of that continue at home after. It's just as if you are working out and stretching, you want to make sure that after your session that you're icing or utilizing heat if that works better for you, and maybe some over-the-counter pain medications if needed. But your session itself should never hurt, and you should speak up if you are feeling like you're to that point where it is painful so that we can adapt and adjust accordingly.
For occupational therapy, I think people might be a little less familiar with that and how that looks in older adults. Can you kind of define it and tell us some of the benefits of it?
Sure. Occupational therapy for us, as we're older and in our setting, is focusing on activities of daily living. So we would focus more on bathing, dressing, grooming, safe showering, and even tasks like shoveling snow or walking in slippery conditions. Things like that that are now part of your job or your everyday life are the things that occupational therapy work on. Some fun activities we work on: cooking, safety in the kitchen, how maybe to carry and move things around now that you're maybe using a walker or a wheelchair or cane, carrying pots, pans, and being able to cook. We also focus on cognition. If you're having trouble with memory, occupational therapy and speech therapy overlap a little bit in that area. But if there's things like medication management, if you're struggling to recall when and how to take your meds, just general memory strategies to kind of help with everyday living. So that's the main focuses of occupational therapy. We also see people coming in who maybe are post a fall. Maybe they have a strain or a fracture, wrist, hand, elbow, sometimes even shoulder. Occupational therapy will address as well. Because even though physical therapy might work on the range of motion and movement, things like brushing your hair or feeding yourself may be different. If you've hurt your primary hand, maybe your right hand, and you hurt your right hand, learning to do things with your left hand may be something that occupational therapy will help with. They also introduce some adaptive equipment if needed during that time while you're recovering to be able to do things that you're typically used to doing while you're healing. You might need to do it in a different manner. So they offer that as well.
For speech therapy, another one that maybe people don't think of in older adults or adults in general as much? Again, can you just kind of define it and who might benefit most from that?
Absolutely. I'm a speech pathologist myself, so that's my
Great.
my specialty, my favorite area to probably
Okay.
talk about. Um, I think when you think of speech therapy, a lot of people go right to like elementary school, working
Yeah.
on sounds. In this kind of a setting where we see a diverse type of patient. For outpatient, we might be working with somebody who has a neurological disorder. So maybe they've had a stroke and they're continuing to have some word finding difficulties. Maybe someone who has Parkinson's disease who is struggling with the vocal volume. Maybe they're a little soft spoken and they need to practice how to project and how to be clear. So maybe that they can be understood in person as well as over the phone. We will work with cognition. Like I said, we overlap a little bit with occupational therapy and working on memory strategies, putting adaptations into place so that you can safely live at home and manage maybe your finances and your medications. We also do a large grouping of our patients are dysphagia or swallowing disorders. We will work with patients who are having some coughing, some choking, some difficulty managing meals safely. And that is something that's kind of like a silent problem as we age. Our muscles in our neck do become a little bit weaker, and we do have some changes in our swallowing that can impact us. And noticing those things like coughing during or after meals, runny nose during or after meals, sneezing after meals, signs or symptoms of maybe a reflux or things coming back up. Difficulty getting pills down is another thing. Some patients are like nervous to come because they're worried if they're choking, maybe that something's wrong, something's really wrong. They jump to the worst thing, I have cancer or something. And not that we still should rule those things out, but sometimes it's just a change in a positioning of our head, of how we take our medications, the type of food that we're eating. So much smaller adaptations can be made to make your meal safer, to make you less worried and anxious while you're eating, and less likely to get upper respiratory infections as well if you are having some issues like penetration or aspiration when you're eating. So we see a wide range of patients, but I feel like that swallowing piece is a piece that not many people are aware of, and it's really important, and that's where we see most with aging changes that we can really make a difference to avoid clinical things like pneumonias and upper respiratory infections that can really be debilitating.
Outside of like a formal therapy session, are there things at home people can do to kind of more like preventative things, or things that they can do to kind of stay on top of these sort of areas?
Absolutely. That's where some of our wellness kind of classes will come into play. Right now during the pandemic, we are have eliminated those for the time being, but you can do a lot of those things at home. Sometimes chair exercises, sitting, stretching, walking is good. I know right now in the snow, that's not something that we would encourage you going out and walking in the slippery conditions, but walking throughout your home, making it a goal to not be sedentary is helpful, not only for physical therapy, but keeping your breath support up, being able, if you are somebody who has some difficulty with swallowing, it helps to keep the lungs clear, just movement in general stretching. And if you're someone who can tolerate yoga, Pilates, those kind of low impact exercise programs are really good as well. We can develop home exercise programs. So it's something that if someone wants to come in just for an evaluation and get a program set up that they can continue with at home and just kind of check in with us, we can do that. And then we do a lot more kind of like we're doing now of telehealth or telecommunication that's available too, that you could maybe be working on home exercises and tap into a therapist and just say, am I doing this right? Or what's the next level now that I'm doing this? I want to kind of progress a little bit more. You don't need a lot of fancy equipment, and you don't need a lot of instruction, just kind of the setup and the commitment to follow through every day of just general movement.
And then kind of finishing up here, if people are having maybe noticing some signs at home, they're maybe trying to do these at-home techniques, what are some signs that people may need to look for more professional help in a formal setting?
For physical therapy end of things, falls, feeling unsteady, dizziness, furniture walking, feeling like you have to hold on to things while you're moving would be a sign to me. Occupational therapy, if you're struggling with like meal preparations, doing your everyday tasks, laundry, maybe walking up and down stairs, taking a dog in and out, speech therapy, if you're like we talked to difficulty with meals or intake, or just feeling like your memory's not as sharp. It doesn't have to be a huge incident to bring you to therapy. Those incidents are often, you need therapy. It's those little things like maybe some aches and pains. Maybe it's a general arthritic pain, but there are things that we can do to help with that management of the pain so that it doesn't stop you from doing the things you enjoy doing. So we wouldn't want someone to have knee pain that is stopping them from being able to walk as far as they want to, stopping them from being able to drive or to lift and do things that they've always done or they enjoy doing. That's a time, I think, to seek us out. When you find that you can no longer do things that you wanted to do or do them in the way that you used to, we have a lot of things that we can do to help you so that you can enjoy your days as pain-free as possible. I feel like any time you have that kind of like shift, it's good to reach out. And there's no harm in reaching out. And even if it is just an evaluation, kind of set you on the right track. Other times you might need a couple sessions, maybe a little bit longer of a course of therapy. And we also do like fine tuning. Like maybe you've gone through the course of therapy, but things have shifted a little bit for the better or the worse. We're happy to see you back again to adapt your program. No one stays real stagnant. We would like to be able to change it up and help you for whatever phases come your way at that point.
Thank you so much for joining us. We really appreciate you doing this. And
absolutely.
Yeah. Thank you very much.
Yeah, feel free to reach out if there's anything I could do to help or any other additional questions. I'd be glad to help.